Hello guys, I hope you're okay, and today we're going through ACE inhibitor sort of cautions and contraindications, and a very important point is diuretics with ACE inhibitors. So ACE inhibitors like Ramipril can cause hyperkalemia, and so can diuretics like potassium sparing diuretics. So it would make sense why you would not want to give potassium sparing diuretics with ACE inhibitors, because they can both cause hyperkalemia. So the mnemonic to remember that is thanks be. So trimethoprim, heparins, Ramipril, potassium sparing diuretics, ACE inhibitors, and those sorts of medications. So concomitant diuretics, diabetes, it may lower blood glucose, increase risk of hyperkalemia, as we've mentioned. So these are some basic points about that, and let's go on to carbamazepine quickly, as I wanted to quickly sort of skim through that. So with carbamazepine, a very important point is, so carbamazepine should be withdrawn in cases of aggravated liver dysfunction or acute liver disease, and that is a very important point. In addition, the topics about alleles, so HLA-B1502 alleles in Han Chinese or Thai origin is associated with an increased risk of SGS. If you have patients that are European or Japanese, they may have an increased risk of cutaneous ADRs as well. So watch out for that. So these alleles are referenced in the exam many times. Now, another important point I want to talk about is colchicine. So colchicine is given in acute gout. So allopurinol is for prevention of gout. Colchicine is for acute gout, and that is something that is important to understand. So just to show allopurinol as well. So this is allopurinol, and it's used for prevention of gout, so prophylaxis of gout. So people tend to get confused with these. And just to go through a quick sort of exam question. So here. So the patient, a 68-year-old man, is experiencing an acute attack of gout, and they have a STEMI 3 years ago and have mild osteoarthritis. Which of the following is the most suitable drug treatment for his acute attack of gout? Now we know that colchicine is used for acute gout, and it's not allopurinol. So watch out for that in the exam. Thank you so much.